You sit down in your favorite chair, and there it is. That deep, nagging ache in your lower back. You try stretching, you take the pills, but nothing works. What if your spine isn't actually the broken part? Decades ago, the legendary Dr. John Sarno discovered a hidden cause of chronic back pain that most doctors completely miss. Give me just a few minutes, and I'll show you Dr. Sarno's 5-minute secret to finally turning that pain off for good. Welcome back. If you clicked on this video, you are likely exhausted. Not just physically tired, but mentally drained from constantly managing your back pain. You wake up stiff. Getting out of your truck feels like a chore. And simply tying your shoes in the morning requires a game plan. You have probably done what any responsible man does. You went to the doctor. You got the MRI. And the doctor pointed at the screen and used scary words like bulging disc, herniated disc, or spinal degeneration. They told you that you have the spine of an older man, and that this pain is just your new reality. You were told to stop lifting heavy things, get a firmer mattress, and maybe consider surgery down the line. But here is the truth that the late, great Dr. John Sarno brought to the medical world. Those abnormalities on your MRI? They are completely normal. Dr. Sarno used to say that bulging discs are just the gray hairs of the spine. Everyone gets them as they age, but they do not equal pain. So, if your spine isn't actually broken, why does it feel like a knife is twisting in your lower back every time you move? To fix the pain, we have to look away from the bones and look at the software running your body. Dr. Sarno made a groundbreaking discovery. He found that severe, chronic lower back pain is rarely a structural problem. It is a condition he named tension myositis syndrome, or TMS. Let me explain this without the heavy medical jargon. As men, we carry a lot on our shoulders. Financial pressure, career stress, family responsibilities, and the underlying anxiety of getting older. We are taught to swallow those emotions, push through the stress, and just get the job done. But your brain is a survival machine. When it senses that you are under extreme, suppressed psychological tension, it tries to protect you. How? By creating a physical distraction. Your brain literally restricts mild blood flow and oxygen to the muscles, nerves, and tendons in your lower back. Imagine a garden hose with water flowing freely. Now, imagine putting a tight kink in that hose. The water pressure builds up, and the flow stops. That is exactly what your nervous system is doing to your lower back. It kinks the blood flow. When your back muscles are starved of oxygen, they spasm. They cramp. They send agonizing pain signals to your brain. The pain is 100% real. You are not making it up. But the source of the pain is not a broken spine. It is oxygen deprivation caused by hidden tension. But before we get to the exact 5-minute fix you can do right now to restore that oxygen, you need to know why your favorite morning stretch is actually making this tension worse. Here is the trap most guys fall into. When your back hurts, you treat it like a sports injury. You stretch it aggressively. You ice it. You buy expensive ergonomic chairs. You stop playing golf. You move like a fragile piece of glass. Dr. Sarno warned us that treating TMS like a physical injury is the worst thing you can do. Why? Because it reinforces the brain's false message that your back is broken. Every time you gingerly bend over, every time you ice your lower back, you are telling your nervous system, "You are right, I am injured." Keep sending the pain. It becomes a cycle of fear. Fear causes tension. Tension restricts oxygen. Restricted oxygen causes pain. And pain causes more fear. To break the cycle, we have to use Dr. Sarno's proven methods. We have to speak directly to your nervous system and turn off the alarm. Here are 3 highly actionable, practical steps based on Dr. Sarno's medical philosophy that you can do right now, from the comfort of your own home. Step 1 is what Dr. Sarno called the knowledge. This isn't a physical exercise. It is a mental shift, and it is the most crucial step of all. You must fully accept that your back is physically healthy. Your spine is strong. It is capable of supporting you. You do not have a structural injury. You have an oxygen deprivation problem caused by tension. Every time you feel that twinge in your lower back, instead of panicking, I want you to literally say out loud to yourself, "My back is fine. This is just tension. I am safe." It sounds simple, but this is a medical technique. By removing the fear of a broken spine, you immediately signal your autonomic nervous system to stand down. You are telling the brain that its physical distraction is no longer working. Over time, the brain stops kinking the garden hose, and the blood flow returns. Step 2 is the physical counterattack. Since TMS is caused by the brain depriving your lower back muscles of oxygen, we are going to manually flood the system with it. I call this the oxygen flush. Sit in a comfortable chair. Do not worry about having perfect, rigid posture. Just get comfortable. Place your hand on your belly. Breathe in deeply through your nose for 4 seconds, letting your belly push your hand out. Hold it for 2 seconds. Now, exhale slowly through your mouth for 6 seconds. Do this for 2 minutes. This deep, diaphragmatic breathing activates your vagus nerve. It forces your body out of the fight or flight stress mode and into the rest and digest mode. As your nervous system calms down, the capillaries in your lower back physically open up. Oxygen rushes back into the starved muscles, shutting down the spasms naturally. Step 3 is Dr. Sarno's legendary 5-minute daily fix. If the pain is caused by repressed tension, frustration, and anger, you have to get it out of your body. Every morning, take 5 minutes. Grab a cheap notebook and a pen. Write down everything that is bothering you. The financial worries, the annoying coworker, the fear of getting older, the stress you don't talk about with your friends. Write it fast, write it messy, and don't hold back. This is not a gratitude journal. This is a tension dump. By taking those subconscious pressures and putting them onto physical paper, you are releasing the psychological valve. Your brain no longer needs to create back pain to distract you, because you are actively acknowledging the stress. When you are done writing, you can rip the paper up and throw it away. The tension is out. Managing chronic pain doesn't always require a surgeon's scalpel or a lifetime of pills. Sometimes, it requires understanding how incredibly powerful your mind-body connection truly is. Dr. John Sarno proved that your body is designed to heal. You just have to stop treating the wrong problem. Try the tension dump and the oxygen flush tomorrow morning. Give it time, and see how your back responds when you finally remove the fear. If this video opened your eyes to a new way of healing, hit the like button so this can reach other men who are tired of living in pain. Subscribe to the channel for more powerful, practical health advice rooted in real medical truths. Stay strong, stay active, and I will see you in the next video.